Can anxiety cause back pain? Well, actually it can. In fact, it's highly likely. Anxiety caused my back pain for years, and I didn't fully recover until I understood the relationship between the two. So, what is anxiety exactly? Are you sure that you actually have it? Here's the Mayo Clinic's definition of anxiety. Anxiety is intense, excessive, and persistent worry and fear about everyday situations and future events. Symptoms of anxiety include trouble concentrating and making decisions, feeling irritable, tense, or restless, gastrointestinal distress, heart palpitations, sweating, trembling, or shaking, trouble sleeping, and having a sense of impending doom. And I agree with all those symptoms, but one symptom that should also be on that list is back pain. The medical community doesn't acknowledge that anxiety creates back pain, and that makes the healing process even harder. Approximately 99% of all chronic back pain is emotional in origin, meaning it's caused by stress and tension, anxiety, fear, and repressed emotions like anger. Now, I was diagnosed with herniated discs by 3 different spine surgeons, and they all told me I needed immediate surgery or I might be paralyzed. And that was pretty scary. But fortunately, they were all wrong. I never had surgery. I instead found this connection to anxiety, and I've been pain-free ever since. So why are doctors so wrong about back pain? Well, because if anxiety does indeed cause almost all back pain, they don't make any money. It's pretty simple, actually. And to be fair, they're all trained that back pain is always a spine problem. When a patient presents with back pain, they just stick them in an MRI and look for spinal abnormalities. But here's the problem with that. Your spine may not be perfectly straight like it was when you were 12 years old, but that does not mean it's causing your back pain. Usually it's not. It's very poor deductive reasoning. You see, the spine settles over the years, but that's perfectly normal. The spine is strong and resilient, and it can and should last a lifetime without causing any pain. So, spinal abnormalities like my herniated discs are in fact completely normal and not causing pain. Now, anxiety, on the other hand, that's a different story. Anxiety can cause all kinds of problems. How does anxiety create back pain? Long-term anxiety puts the entire body in fight or flight mode. Now, fight or flight tightens up all the muscles in the body in order to instantly prepare the body to either fight or flee a perceived dangerous or life-threatening event. Nowadays, fight or flight can be triggered by an angry social media post. So, fight or flight tightens the whole body. So, why is it that back pain is the most common symptom? Well, it's because we modern humans are always sitting down and always compressing our back and glute muscles. Our ancestors, on the other hand, never sat down. They didn't even have chairs. We're always sitting down, whether it's in cars, at home, in the office, at restaurants, pretty much everywhere. So in reality, your back pain is most likely caused by both anxiety, which tightens the back, and sitting, which compresses the back. That's really what's going on here, and there's no need for surgery. How do you cure anxiety-based back pain? However, switching to decaf is probably not going to work. It's not quite that simple. I personally did a ton of research on the mind-body connection and became an expert on the topic. I knew I needed to understand all the psychology, the science, the physiology that would support this connection between anxiety and back pain. I knew I needed rock-solid proof before I could accept that my doctor, my chiropractor, my spine surgeon, and even my MRI results were wrong so that I could let go of the pain and finally heal. Now, I also took a look at my stressful life and made some changes. I knew I needed to calm my hyperactive nervous system down if I was ever going to have a chance at getting better. And then finally, I knew I needed to start moving again. Over the years, my body had become tight and painful, and I was afraid to move. I knew I needed to start moving and become more flexible again if I was ever going to heal. And now this combination of a new mindset, reduced anxiety, and increased physicality released my chronic back pain in just a couple of months. And that was way back in 2016, and it has never come back. And you can do this too. In fact, you can watch a free 6-minute workshop that we put together for healing anxiety-based back pain at calmyourback.com, and there's a link below this video. And please, before you go, hit that subscribe button, and thanks for watching.